Welcome you to our press briefing with updates on COVID-19. As of this morning, we've lost over 150 citizens in our community. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we will hear updates from our community leaders, and first we'll hear from City of Albany Mayor, Mr. Bo Durham. Mr. Mayor.
Thank you, Chief Scott. Good morning. I have some numbers here, and Dr. Black will elaborate on some of these statistics, and as will Dr. Ruiz. But Mr. Steiner, the CEO at Phoebe, sent out a report just last night, and apparently 12% of those being tested are positive, and that is about 3 times the rate that the hospital was seeing in June. From the Department of Public Health website, in the state of Georgia, since June 23rd, there have been more than 3,000 new cases each day in the state of Georgia. Nationally, since June 29th, more than 1.2 million people have tested positive. So nationally, we have more than 1.2 million additional cases since June 29th. There is speculation as to the cause of this. I think the proper term is a rebound. Some of it has to do, obviously, with July 4th, but Dr. Ruiz mentioned on a conference call earlier this week, a primary factor is what he called risky behavior. And that is similar. An example of that is the concert that occurred last weekend down at the drag strip. Now, I received numerous emails, people upset with me about it, seem to be incredulous, some people, when I say that I had no idea it was going on. I saw no advertisement. I don't know if a permit was granted for this event or not. But what I would like to do at the start of my comments today is request that any promoter that has an event like this scheduled, cancel it immediately. One explanation was that this concert had been scheduled some time ago. Now, again, I guess that's the way young people do things. You can promote without radio, without TV, using social media. But again, we don't need to have these type gatherings. We all know this. And my concern is primarily with young people who, throughout this entire pandemic, have failed to exercise precautions to protect themselves and others. I do want to say one thing before I get to my main topic, which is the possibility of a mask ordinance. Dr. Toomey, and I'll ask Dr. Ruiz to elaborate on this, at a conference call last week, she mentioned the fact that the death rate is not increasing at the same proportion as the number of people who are testing positive. She attributed this to 3 main factors, one of which is that so many younger people are contracting the virus, and we know that very few young people become seriously ill. Secondly is that people being diagnosed, because of the expansive testing, more people are being diagnosed earlier, and they're receiving treatment before they progress into the advanced stages of disease. And thirdly is the improved treatment, and Dr. Black can speak to that. Apparently there's some medications and techniques that are seeing some success. Fewer people also are being placed on ventilators. But now let me talk about an issue. I have received numerous emails, phone calls from friends, supporters, constituents. The vast majority of people would like to see the City of Albany enact an ordinance requiring the public to wear a face mask. A few people, of course, have the position that the medical evidence doesn't support this, it's my right, et cetera, et cetera. But I want to explain to the citizens of Albany, I have taken issue with the provision of Governor Kemp's executive order since it was, the first order was enacted, saying local governments cannot take any action which is any more or less restrictive than this executive order. I think that is very poor policy, and I don't think it's good reasoning. I've also questioned the legality of it because there get to be issues of, can the city require people to wear masks in city buildings? I would think certainly we can do that. Certainly we can require our own employees, but this is causing a problem with some employees who feel that, well, the governor said I don't have to wear a mask and you can't make me wear a mask. We are getting mixed signals, which are not good in this time. For the state agency, the Board of Regents says you have to wear a mask on college campuses, and then the governor is going to tell local governments you can't require it in your localities. And then when the governor and Dr. Toomey go around the state encouraging people to wear masks, but then prohibiting local governments from requiring the public to wear masks. Hopefully, this is going to come to a conclusion with the litigation that is now pending in Fulton County. And I believe that that litigation is a good thing because hopefully Mayor Bottoms and the governor will be able to come to some compromise. I question whether or not this provision in the executive order is even legal because the legislature, in giving the governor the powers that he has under the Emergency Management Act, authorized him to act for the health and safety of the people of Georgia. How can prohibiting a local government from requiring the public to do something that protects the public further that charge? I don't think it can. But hopefully, cooler heads will prevail and there will be some type of agreement. And I would like to say to the citizens of Doherty County, citizens of Albany, that I would support an ordinance. And I feel we should have an ordinance. But our city attorney has advised us any such ordinance, like has been enacted in Savannah, Athens, Clark County, and Atlanta, would be contrary to the governor's executive order. And as long as that executive order is in place, all we can do is continue to recommend that our citizens wear masks, primarily to protect others. And Dr. Ruiz can talk about this. We've learned these terms, what's the difference in aerosol and a droplet. Well, what we know, and this is what I can say to the knuckleheads who say, now there have been reports in peer-reviewed journals, there has been studies. There is no doubt in the medical community that wearing a mask reduces the spread of the virus, period. Now, people are going to continue to make these arguments and claims, but we can give you the citations. One was at Texas A&M, and the other one was in the Journal of American Medicine. These reports are out there. We know it. So until that time, what we can do is I want to applaud Walmart and other businesses which are requiring customers to wear masks. And I want to encourage other businesses to consider that. And I know that for these big box stores, that's probably a decision that's made in some corporate office, but it's a decision that needs to be made. And I want to commend, I've gone in grocery stores and actually, I hope no one saw me. I was going down the aisle and I noticed everyone was going the other way. And I realized that there were errors on the aisles. Chairman Cohilas had called on big box stores to make that accommodation sometime before, and it's been made. And I want to commend this Publix for doing that, and also apologize for going down the wrong aisle when I did. But with that, let me say that until this issue about the mask is resolved, we want to encourage everyone, whenever you're in public or in close proximity to others, to wear a mask to protect yourself and others. That is simple. The city of Albany continues to require individuals coming into city buildings to wear masks. Our employees are wearing masks throughout the day. They're wearing masks to protect you, the public, and we would expect that you could also make that small concession. But with that, I will look forward to the further reports today, but as I said at the beginning of my comments, the trends are not going in the right direction. Thank you.
Thank you, Mr. Mayor. Now we will hear from Commission Chairman, Mr. Christopher Cohelas.
Thank you, Chief. Thank you, Mayor. This morning is an important update, and I want to sort of focus us on something that's been said, that I've said, and that others have said throughout this entire process. This is not a sprint. This is a marathon. Whether you want to call it a rebound, a second phase, a secondary spike, whatever you want to call it, this is something that we all knew that was coming. And frankly, we're in a very good position to handle what we are actually handling. Many communities are seeing a rate of transmission that is far higher than our community. Are we? Yes. Are we absolutely back on a second rebound? Absolutely. Are we in a place where we were 3-4 months ago, where things seemed absolutely apocalyptic? Everyone felt like the roof was caving in, the sky was falling, we weren't sure what to do, we were hearing about people dying every single day. No, we're nowhere near where we were. We've had good decisions that have been made. We've instituted good policies. We've changed the way that we've reacted as a culture and as a community to be able to be safer. Does that mean that everyone is perfectly safe? Absolutely not. Does that mean that there have been additional fatalities? Absolutely, there have. Does it mean that we have greatly reduced the overall death rate in our community? And is that consistent with what is going on across the rest of the state and much of the rest of the country? Yes, absolutely. So what we're seeing is not anything that is abnormal to our community. And frankly, I think because of what we sustained at the beginning of this entire pandemic, us being number 3 in the world, we literally were tried by fire and frankly had to hone our skills faster than any other community, I would dare say, in the state and perhaps most in the entire nation. Because if you'll recall, we were literally number 3 in the world, behind the Wuhan province and the Lombardy region of Italy. So that's a tremendous amount of knowledge and experience for a small community to have to gain within a small period of time. Now, what are the objective things that we absolutely know to be true at this point in time? At this point in time, our hospitalizations are going up. Are they going up at a meteoric rate? In other words, are we seeing things where we're running out of hospital beds? No, we're in a good position. But what we are doing currently is admitting more people into our hospital than we are discharging on every single day. So what does that mean? That means over time, you start building up occupancy in those hospital beds that we need to maintain. And you can maintain this for a period of time because we have the resources, and we have a great partner at Phoebe, and we have phenomenal healthcare workers. We have people that are counting this information and reporting it back to a COVID task force every single day so that we can manage these assets for our community. One of the things I think that people need to understand regarding this entire pandemic and the reasons why we take so many of the steps that we take. Nothing that we do, there's absolutely nothing that we do that is designed to cure this disease. There's nothing that we do that is designed to kill off this virus. In fact, the majority of, if not almost all of the recommendations relate to 2 things. Or 3 things. 1, keeping people healthy. Say that 3 times fast. Keeping people healthy. Keeping our medically fragile, our elderly safe. And protecting our hospital resources. Our ability to make sure that we have a certain number of ICU beds in the community. available for those who are medically fragile and elderly, that is a tremendous asset. So when we go through these different exercises and we talk about the transmission rate, what we're really trying to do is manage the number of ICU beds that we have in a community, in the unfortunate situations where we have people that are in elderly homes or nursing homes, or people that are medically fragile that get this disease, or just people that are medically vulnerable and they have to be hospitalized and they have to be put on a ventilator. So I want to make sure that that's very clear. Nothing that we have seen thus far actually cures the disease. And so we're going back through this process just like everyone else is across the entire country. I've heard the debate about the mask, and frankly, I'm not concerned with the politics of it. I don't think that masks and pandemics, frankly, are political events. Here's the reality. Do masks help? Yes. Do they work? Yes. Do they help prevent people from spreading it to each other? Yes. Are we all normal human individuals that have the right of free will to make our own decisions as to whether we will or we will not wear a mask when we go into public? Yes. Do we have to have someone to tell us what to do when we get up every single morning and what to wear when it comes to our shirt, our pants, our belt, or anything else? No. We all make our own decisions. And so what I would say is, absolutely, masks are highly effective. They're highly effective, and frankly, they have proven to be remarkably effective in this community where we have proliferated a tremendous number of masks and even made them available to the public. I think we've even amassed about 100 or 150,000 masks that we've continued to distribute. Please continue to wear masks. It's a smart idea. Going to a concert at a drag strip, standing next to thousands of other people and children that are not wearing masks, arm to arm, in a hot venue where people are sweating and breathing and coughing. That's a bad decision. That's an irresponsible decision. It's an absolutely irresponsible decision. And those are decisions that do not help our community. And what I would say to everybody is this: just go through this analysis when you face these types of decisions each day. Is this a good decision or is it a bad decision? Is it good for my community or is it bad for my community? Does it make people safe or does it put people at risk? And then utilize that as your rubric for deciding whether or not you want to wear a mask or you want to do this. We don't need people to tell us how to live our lives. Frankly, this community has picked itself up through 4 presidentially declared natural disasters and a pandemic. I could care less about the overall political arguments that are going to occur between different elected officials in one part of the state and another part of the state. What we just need to do is focus on the basics. Do the things that we know work. Social distance. Don't get in large crowds. Let's wash and information there. We have so many testing opportunities that are available in our community. And in fact, many have access at the many different medical providers in the community to antibody testing as well. And that's one of the things I also want to talk about today, because one of the things that we're going to have to assess in our community is how close are we to reaching herd immunity? How many people in our community have not only gotten the virus, but have gotten the virus and actually recovered from the virus? And we know, and I was really, really pleased to hear this information from Dr. Ruiz on a call the other day, which is that there has been no credible evidence of anyone recontracting the virus within 6 months of having recovered from it. So that is, and I'm not a doctor, I'm not an epidemiologist, but I have some common sense, and I think we all do. That's highly suggestive that people that get this virus and overcome it have a degree of immunity. That's why you see doctors and hospitals, they're making this big move towards trying to get people that have overcome the virus to donate their plasma, because that plasma is being utilized to help those that are in a worse off situation, that are more vulnerable. The people that have overcome the virus and have that immunity, that's a valuable resource, a valuable commodity, a valuable component of information that we need to harvest in this community. And in fact, that is why I've pushed very hard for us to do a community-wide antibody testing. And that is going to be done in collaboration. I want to thank the mayor for his collaboration. I want to thank the school board. The county just approved its participation in this. It's a three-way purchase. We're providing savings to the citizens because we actually purchased it between the city, the school board, and the county for a community assessment of our antibody testing. And they're going to do that. They're going to provide that information to us, and it's going to provide us with an overall picture of the number of people that have and have not overcome the virus. And that gives us an idea, because as I understand it from talking with medical professionals, that when you reach a certain level of infection and recovery in your community, you are potentially able to reach what is called herd immunity. And what is herd immunity? It's a point at which the virus is not able to meaningfully proliferate and continue to move through your community. It means enough people have immunity to the virus. And that's an important piece of information for us to begin to assess. And I'll say this, there is currently no knockout punch for COVID-19. It's not a mask, it's not a magic wand, it's not anything. The best tool that we have against this virus is our discipline, our vigilance, and our common sense. Thank you.
Thank you, Mr. Chairman, for your comments today. We will now hear from our representative from Phoebe Putney Memorial Hospital. Dr. James Black is with us today. He is the chairman of the emergency department. Dr. Black.
Good morning. I tell you, we have a double-edged sword. I can't tell you what a blessing we have that our communities come together in such a multidisciplinary approach to fight this. And having community leaders such as Mayor Doherty and Chairman Cahiles, who are so intertwined and have become so knowledgeable about not only the fighting of disease, but medicine in general. The problem with that is that when I come up here third after the two of them have got to telling you so much of the medicine, it doesn't leave me that much to say. But it's a good problem to have. As I continue to be involved in a lot of discussion, both on the local level, but also on the national level, you would be proud to know how well regarded our community is and what kind of light we're seeing nationwide and what kind of a model we provide for a lot of people around the state and around the nation, not only from our decisions that we've made, but the way we have come to decisions. And as we said before, we don't need any state or national mandate to tell us how to take care of our community. And we have done a very good job of banding together to fight this pandemic. Unfortunately, we're here today because our numbers are rising and trending in a not so good direction. And it wasn't too long ago, around the middle parts of June, that our total inpatient COVID numbers were down in the low 30s, and it's across the system. As of yesterday, our number for the system had risen to 72, and this morning our current number is 76 or 77. And on the one hand, you know, when we had those days when we were seeing and admitting and transferring out anywhere from 60 to 70 patients a day, admitting 10 patients or so, 10 to 14 patients a day doesn't seem like a lot, but if you admit 10 and discharge 5, you're gaining 5 patients a day that are COVID positive. And while we sit at 76 or 77 now, if we have a net gain of 5 every day for the next week, then we'll be above 100. So you can quickly see how this can spiral, and we must do everything as can, and that's why we reconvene to kind of redouble our efforts at protecting ourselves. As been said by Mayor Doherty and Chairman Cahiles, we are comparatively in a pretty good place with respect to the rise of numbers. Our rates are not rising as fast as they are in some of our neighboring communities that are experiencing what we saw back in the early part of this year. That being said, our numbers are still going up, and I am seeing patients who are traveling because we have done so well. They're feeling very confident about traveling, but they're coming back 3 days to a week after they travel, saying they're having COVID symptoms. So all of that to say is we still have to make good choices, along with wearing masks, along with washing our hands, along with socially distancing when possible. Let's make a few more good decisions in making travel an absolute, something that we do only when it's absolutely necessary, because as we travel to other areas, particularly very convenient vacation spots, realize that their rate of infection and their rate of illness far surpasses ours, and you actually increase your risk when you leave and you travel other parts of the state and other countries. So let's be very cognizant of that. We have to continue to make good choices. With that, I also want you to realize that we're going to be very nimble, as we have been, and making decisions. And we have reinstituted the temperature checks at the door of the hospital. Of course, our masking policy has always been in place, but just be prepared for that. We would be making decisions on a frequent basis as dictated in order to keep our patients safe and keep our staff safe as well, and to keep the public safe. We have to keep the hospital as resilient and as capable as we can, and sometimes that involves imposing some restrictions that are sometimes inconvenient, but absolutely necessary in order to maintain the safety of the public. We are in a unique and good position to have 2 facilities, and we're able to, by and large, put our positive COVID patients in one facility, not only helping protect the non-COVID patients and population, but also to facilitate their care. And this is a model that's been, again, looked at and attempted to be duplicated in a lot of places around the country with varying levels of success. But again, we're looked upon as a model, and we're taking steps now to increase our ability to continue to take care of patients and increase the number of patients that we can take care of. I also realize that we're also being asked by a lot of our neighboring communities in various places around the state and from other states if they can transfer patients in. The bed situation across the country is in a really precarious position. And so we're doing everything we can to help our neighbors, but also realizing that we have to take care of our population here. So I just want us to continue to do everything we can to maintain our safety. And again, it can't be said often enough, proper wearing of the face mask. I should say proper wearing. I still see some people who are having a scarf or a chin strap, and some people have a nose guard, and other people have a bandana. It's got to cover your nose and your mouth, okay? Make sure you wash your hands, socially distance when possible. And I know that a lot of conversation has been surrounding a recent concert and some other events with a large number of people, but I've also seen large number of gatherings at home, and you don't have to be in a crowd of 3,000. A crowd of 30 with 1 or 2 people who are spreading the virus can also put us in a pretty bad situation. So let's continue to make good choices. Sometimes I think we're victims of our own success. We did such a wonderful job of changing our behavior and changing attitudes that we may have become a little bit cavalier at this point in time when we're dealing with this. But I want us to revert to the policies and the cultures and the habits that we developed early on as we continue to fight this pandemic. Thank you very much for your time.
Thank you, Dr. Black, for your comments. Today, we will now hear from the Director of the Southwest Georgia District of the Department of Public Health, Dr. Charles Lewis.
Thank you, Chief Scott. The previous speakers have all shared accurate and very valuable information. I'm going to try not to be redundant, but I hope to build upon what they have said and add a little bit more information. I'm sorry, I'm trying to get the slides to. Okay. I think some help is on the way. So yes, the numbers are going up. Oh, here we go. Let's see. Okay, so the numbers, as it has been stated, have been going up, not going in the right direction. I've got a graph here for those who can see the graph. The upper left part of the graph shows the number of new cases in our health district. This is the 14-county Southwest Georgia Health District. So you can see that back in March and early April, our numbers of new cases were very high. And then as time went on, number of new cases went down, and then they're back up again. And then that line graph on the right, on the upper side, is a reflection of what you see on the left. Now look at the bottom of that graph, and what we're seeing there is the deaths. So you can see how the high number of deaths closely paralleled the number of new cases back in late March and early April. And as time has passed, the number of deaths has dwindled down quite a bit. And if there's any good news at all today, it's that in spite of the sharp increase in new cases of COVID-19 in the community, the death numbers have not paralleled that. And we hope that that trend will continue. So now the similar slides are a reflection of what's going on in Doherty County. Again, on the upper left side, you see the number of new cases. We had a lot in late March and early April, and you can follow that out to the right, and you can see that the number of new cases is going up again. But again, on the bottom, the left side, the number of deaths is not going up as sharply, and certainly not in proportion to the number of new cases. So that is some degree of encouragement. So it's reasonable to ask, why are the cases going up again? And one reason, I do believe, is because of unsafe actions, choices that people are making that are just not wise. So when we go out into the community and when we don't practice social distancing, when we don't wear masks, we're putting ourselves and everyone else at risk. Another thing that we see over and over again as we investigate dozens and dozens of cases every day throughout the district, we're seeing people who know that they are symptomatic, yet they leave home, they go to work, they go attend social events, and oftentimes this will spread the infection. So in many cases, it's not a mystery. We know why this is spreading, and we know that there's some things that we can do about it. Obviously, if we're sick, we can stay home. If we get out of the home, we can wear a mask. We can practice social distancing. Another thing that we haven't talked about a lot is screening, and I do want to spend a minute or two to talk about the importance of screening, particularly when it comes to going to work and going to school. It's highly recommended that screening takes place at the workplace and at schools before students and before workers enter the building. So this ideally consists of checking the temperature of the person coming to work or school, and then going through a series of questions designed to determine whether or not the person is experiencing any of the typical COVID-19 symptoms. And I know a lot of places are doing this, but one thing we haven't really talked enough about is, what do you do if a person fails the screening? And what we're realizing is that in some cases, when people fail the screening method, they are being asked to go home until they feel better. And that's not what we're after. When you fail the COVID-19 screening, you go home and isolate, and you continue to isolate until it's appropriate for you to come out of isolation under medical or public health guidance. The alternative to this is if you have symptoms suggestive of COVID, and if you undergo a valid test, and if you're negative, then that could be attributed, then the symptoms could be attributed to something other than COVID-19. But the bottom line is, if you fail the screening test, it should be assumed that you have COVID until proven otherwise. We're not saying do a screening test or go through the screening questions and check your temperature, and if you fail, then go home until you feel better. It's much more involved than that. So testing is still readily available, and let's talk for a minute about how to get a test, particularly here in Doherty County. It really does help us a lot if the public would make an appointment to get their test. It helps us to spread the work out. It helps to minimize the number of cars in line when you have an appointment. It helps us to know the extent of staff that we need, and it helps us to make sure that we have the supplies that we need. So there are now two real easy ways to make an appointment. And the one that we're most excited about is the online access to make your own appointment. So on the screen, if you can see it, we've got the web address. It's easy to get to, covid19.dph.ga.gov. It's a quick and easy thing to do. One advantage is you can check and see what appointments are available. You can pick and choose the time for your appointment. You can register online 24 hours a day. It's quick and easy. I am very much low tech, and without any help whatsoever, I can go on and make my own appointment in 5 minutes. Yesterday, I watched a teenager with no assistance make her own appointment in less than 4 minutes. Going online and making your appointment is a lot quicker most of the time than calling to make an appointment. But you can call and make an appointment, 229-352-6567. Operators are there Monday through Saturday. So if you'll make an appointment, it'll work better for everyone. We make it a point to try not to turn anyone away. If they show up without an appointment, we're going to do our best to test them. The next screen, again, emphasizes that you can make those online appointments 24 hours a day, 7 days a week. We have 9 locations currently in the Southwest Georgia Health District: Colquitt County, Decatur, Doherty, Grady, Lee, Mitchell, Terrell, Thomas, and Worth County are all performing the collections for the COVID-19 testing. The schedules vary, sometimes based on the availability of staff, sometimes based on the amount of spread in the community. But it's easy to go online and find out which appointments are available and to select one. I want to say a little bit more about what takes place at the collection sites. We are in transition now. Typically, we have had clinical staff on site to perform the swabs. The swabs we have used in the past are about 3.5 to 4 inches long. They go straight back in the nose. They're a bit unpleasant, and it requires a licensed person to do that test. Well, the technology has improved, and we are now able to get the same results using a swab that only goes about 3/4 of an inch into the nose, so it's much more comfortable. Furthermore, it is possible now for patients to swab themselves. There are many other places in the state of Georgia where the collections are exclusively done with this new method and with the patient swabbing themselves. There are a couple of good reasons why it will help us greatly if you're willing to use this nasal method and if you're willing to do it yourself. One is our staff has to wear this personal protection equipment, and when we're outdoors in 90-degree heat and high humidity, that makes for a really tough day. It actually puts our staff at risk for being overheated and suffering from heat exhaustion or heat stroke. If members of the public are willing to swab themselves, and it's pretty much like taking a Q-tip and just barely going inside your nose, then our staff members don't have to wear as much of the protective gear. They can remain cooler and, I would argue, healthier, and it saves on the supplies of protective gear as well. And then another important thing is, because it doesn't require as many licensed clinicians at these collection sites when people are doing their own swabs, it frees up our nurses to return to their normal health department duties, and that's very important, particularly this time of year when we're trying to get school children vaccinated to go back to school. And we do need to resume some of those routine services that people are accustomed to at the health department, and that's difficult to do when we have half of our staff outside performing these collections. So we're asking, if you will, please work with us and consider coming to get a test, and after we instruct you on how to do it, swab yourself. It'll help us greatly. Another thing that we're kind of excited about is we have been doing the collections in Doherty County at the health department now for about 4 months. And while it's a good facility and it's worked well there, our staff has really been exposed to a lot of heat and humidity. We have entered into an agreement with the Georgia Forestry Commission, And starting this Monday, we're going to relocate our collection site from the health department to the Georgia Forestry Commission location, which is just about 3 blocks south. And I think the official address is 2910 2910 Newton Road. But physically, it's pretty much where South Slappy and Newton Road converge there. So that's starting Monday. We will be performing the collections at that location instead of the health department. So let's talk a little bit about who needs to get tested and when. Well, people who are symptomatic with COVID symptoms certainly need to be tested. People who are close contacts also need to be tested. Let's pause there for just a minute. If you were to be exposed to a person with COVID-19 today, you may wind up getting sick, but you're not going to be sick from that exposure today, nor tomorrow. Generally, it takes at least 48 hours for the virus to incubate and to replicate inside your own body. So you're not going to get sick within the first 2 days. And it's very unlikely that you're going to have a valid positive test within the first 2 days. So what we are recommending is if you have been exposed, and if you know you've been exposed, the ideal time to get tested is probably somewhere between 8 and 10 days. We've known a lot of people who wanted to do the right thing, and after being exposed, they would rush out and get a test. And if you get a test too early, it's not going to provide any useful information, and it's going to tie up supplies and personnel in the process. People who work in the healthcare industry certainly need to be tested and probably need to be tested on a frequent basis. First responders need to be tested. We'll test anyone, but we particularly want people who are symptomatic and people who have been close to those who have been symptomatic to be tested. Let's talk for just a minute about who not to test. That may sound a bit strange, but before I get totally into that, let's talk about some recent CDC guidelines. I think Mr. Kohelis may have touched on that just a little bit before. So on the screen, I've got a couple of things I want to read to you, and it's kind of in scientific language. Then I want to talk about it in plain language. So these are some CDC guidelines. To start with, a couple of things that came out on July the 17th. One goes like this: 6 months after the emergence of COVID-19, there have been no confirmed cases of reinfection. This is from the CDC. This is a very important information to know. I'm asked this question probably a dozen times a week. Can a person be reinfected with COVID-19? We don't know the complete answer to that yet. In the coming months or in a year or two, we may discover that it's possible. But in the first 6 weeks, in the first 6 months of following and monitoring and studying COVID-19, the CDC has found no confirmed cases of reinfection. The next one says, following a mild to moderate COVID-19 infection, the viral genetic material known as RNA is often found in the nasal mucus of survivors. But after 10 days, this RNA has not been found to be capable of replication. So let me boil that down. What we're saying is that if you are sick with COVID-19, you're likely going to have this RNA up in your nose, and it's going to be there for quite a while, as much as 3 months. It's going to be there. But after 10 days, this viral material is not capable of transmitting the infection in the vast majority of cases. So let's talk for a minute about the isolation and what should happen before a person comes out of isolation. There are 3 conditions that have to be met. The symptoms have to be improved. Fever has to be gone for 24 consecutive hours while using no fever-lowering medication. Up until this week, we said 72 hours, but the CDC has modified this, and now only 24 hours are required to be free of fever. And then 10 days must pass since the onset of the first positive test. So let's talk about the implications of what the CDC is saying. And as Mr. Kohelis said, it appears that there must be some immunity, because after 6 months, no one has been found to be reinfected. We can probably conclude that there's some degree of immunity. We don't know if it lasts for 6 months or a year or if it's a lifetime. Another thing that's very important is testing for the sole purpose to prove resolution of a COVID-19 infection is often futile, and in most cases, the symptom-based strategy should be used for returning to work or school, and that's those 3 steps that I mentioned earlier. Over and over again, we're hearing stories of people who say that they had COVID-19 and they've made a complete recovery and that they are not allowed to go back to work because their employer is requiring them to have 2 negative tests to prove that they are over the infection. The CDC does not endorse this. It is simply not necessary. If people follow those 3 requirements, we can feel secure that they have overcome the infection and they are no longer contagious, with the exception of people who might be hospitalized. If people are hospitalized, we would probably want 20 days to pass before they are considered able to go back to work. But those are the minority of cases. For outpatient cases of COVID-19, after 10 days, the vast majority of people are fever-free and their symptoms are improving and they can come out of isolation and they should be able to go back to work. So in closing, I just want to say that we're still in a pandemic. People are still getting sick. People are still dying from COVID-19. This is not over. We urge you to take care of yourself, take care of your community.
Thank you, Dr. Ruiz, for your comments today. I would next like to get an update from Doherty County School System. Ms. Lakeisha Bryant Bruce is here with us today. She is the Director of Community Relations. Ms. Bruce?
On behalf of Superintendent Kenneth Dyer, board members, I'd like to take this opportunity to share an update from the Doherty County School System. Since the start of the pandemic, dozens of district personnel have worked diligently to respond to the impact COVID-19 was having in our community. We worked alongside public health officials, school and district leaders from our region, state, and around the country. We've consulted regularly with other state leaders to offer guidance and seek advice for what we're seeing here in Doherty County. We are acutely aware of what is at stake in terms of the impact of how and when we reopen our schools. We are using data and science to inform our planning and decision-making. Our responsible restart plan balances our strong desire to return to in-person, on-campus instruction with our mandate and responsibility to keep our students and our employees safe. If you've read our plan, you know at its core, it's conditions-based and allows the district the flexibility to pivot based on the rate of community spread of the virus, as well as additional significant external factors regarding testing. Next week, the Doherty County Board of Education, at its July 29th meeting, will formally adopt that all students will begin in the online instructional model with rolling start dates. High school students, grade 9 through 12, will begin on August 17th. Middle school students, grades 6 through 8, will begin on August 24th. Elementary students, pre-K through grade 5, will begin on August 31st. Our online instructional model will be a combination of asynchronous and synchronous learning, teacher-directed assigned instruction, self-paced personalized practice on assignments, including homework, live stream and recorded instruction using one of our district-approved digital platforms, parent resources for additional academic support, including recorded units of study categorized by grade, subject, and standard, and use of approved evidence-based interventions for students in special populations, including ESP and ESOL. Our rolling start dates will also allow for device distribution for teachers to properly connect with students via online orientation, and also provide a window for technical support with students and their devices and their learning platforms. The district will provide a device for any student that does not have a device in the home that will support online instruction. In addition, we have approximately 5,000 Wi-Fi hotspots for households that do not have internet access. Our device distribution dates are: for high school students grade 9 through 12, your devices would be distributed August 3rd through the 7th. Middle school students grade 6 through 8, your distribution dates are August 10th through 14th. And elementary students grades pre-K through 5, your distribution dates are August 17th through the 21st. This delay also allows for us to host open house activities in the safest and most efficient way possible. For most students, your open house this year will take place virtually. Students in transitional grades, pre-K, kindergarten, 6th grade, and 9th grade, along with students that are new to the district for the first time, will have open house by appointment only. We will be sharing more information regarding times and locations for device distribution and how to make appointments for your open house next week on our website, social media, and via our parent notification channels. Our meal distribution will restart on Monday, August 3rd. Meals will be delivered on Mondays and Wednesdays with breakfast and lunch for each day. No weekend meals will be served. The bus routes are based on high school cluster, and we will also share details on the locations and times posted on our website and on our social media pages. We know that many of you have questions about school uniforms and school supplies. COVID-19 has had a substantial financial impact on a number of our families. Retail chains are facing a tough time getting items to their stores in a timely manner. And even when you do online shopping, shipping isn't always made to you in 2 to 3 days. So with these things in mind, Superintendent Dyer plans to recommend to the school board next week that we suspend our uniform policy for this year. We are also finalizing our school supply list that students will need for online instruction and for face-to-face instruction for those that will return to our buildings when we reopen our classrooms. We will share details next week with you on both items. Finally, we encourage all parents and guardians of students in the district to make sure you have updated your contact information in our parent portal, Infinite Campus. We use this information to send important communication for the school year, and your contact information in this portal will also be how teachers will communicate with you regarding your child's academic progress. We have confidence in our plan and our instructional models. We do believe, however, that the best place for students to learn is in the classroom. But we must balance that belief with the need to ensure safety. As a result, we will not open our doors for on-campus instruction until it is both prudent and safe for students and our employees. We all have a collective responsibility to make that happen. We must do whatever we can, whenever we can, to slow the spread of the virus in our community. If we work together and continue to listen to the science, wear your mask when in public. Wash and sanitize your hands frequently. Avoid crowds and practice social distancing. We can get COVID-19 under control.
Thank you, Ms. Bruce, and thank you for being here today to provide an update from Doherty County School System. We will now have an update from our law enforcement, and here to provide the report today is Sheriff Kevin Spruill. Sheriff.
Thank you, Chief. Well, good morning. Much of what I planned on covering today has been covered very thoroughly by the previous speakers and what they had to say, so I'm not going to belabor that point. May reference some of that or come back and highlight it, but I'm not going to belabor what they said. But I do want to thank the citizens of Doherty County here in Albany, Georgia, for all they've done during these past 5 months in helping the Doherty County Sheriff's Office and other law enforcement agencies in our community in complying with the social distancing and the gatherings with the governor's executive order. We have had some situations that hasn't taken place. Some of them has been referenced today. But I want to urge our businesses here in our community, if you have not read that 41-page executive order sent out by Governor Kemp, please read it. Contact the Doherty County Sheriff's Office. We have it available to you. We can get it to you. We need to follow those guidelines that are in place. I'm not keen about wearing a mask. I don't like wearing a mask when it's 90-something degrees outside. But what I am keen on is my safety, my health, and my family's safety and health, and the citizens of our community. You heard Chief Scott at the outset ask for a moment of silence, or we've had over 150 deaths in our community alone. Many of us have been personally affected by these deaths. They've been close to us. They've been family members or been very close individuals that we've known for a long time. So please adhere to this. I urge you and I beg you to please adhere to this. Football is right around the corner. The fall is coming. Students are going to be returning to colleges. We want to try to get back to some kind of sense of normalcy in our country. And as you've heard when Dr. Ruiz got up here with his PowerPoint and showed the numbers going up, and Dr. Black mentioning the numbers going up where we now have 77 back in the hospital, I can just remember a few weeks ago we were down around 40. So you can see there is an uptick in the numbers. You've heard the previous speakers get up here and talk about some poor choices. They use the terms risky behavior, common sense, irresponsible choices. I appreciate those individuals who contacted my office, Chris Cohilas, Mayor Durrell, and other people and said, hey, we had an event this weekend. Were you all aware of it? No, we were not. But we were made aware of it, and I reached out and contacted the proprietor of that event, had a lengthy, almost an hour telephone conversation with him the other night. He did not even know the details of the executive order, so I sent him a copy of that. We read through that over the telephone together. So again, we have to be aware of what's going on in our community and what is around us. So you heard earlier about any number of people who gather. It could be a problem, and it can be. People that are asymptomatic don't know they have it sometimes. Or as you heard Dr. Ruiz mention about waiting 8 to 10 days to be tested. Some people may be carrying the virus and don't even know it. So be careful when you go to these locations where there's large gatherings. I know, talking with the city police chief, Mike Persley, yesterday and this morning, there's been at least 3 incidents where they have been dispatched out to certain blocks in our community where they're having block parties. And not 10, not 20, but hundreds of people were there, and they had grills out. They had ice chests filled with soft drinks and beverages and things like that. Be very careful when you attend these. Stay away from them if you don't know who they are, because you don't know who there may be sick. So you can contact the Doherty County Sheriff's Office at any time if you have any questions. Captain Ken Faust and the staff that works for him are very familiar with this. They will assist you. They will help you. They will come out to your business and walk you through the order and show you what you need to do to fall into compliance. And we're here for you. Our safety and concern for you is at the top of our level for us, and making sure you're safe. So thank you very much, and God bless you.
Thank you, Sheriff, for your comments and update today. I want to pause for a moment to open up for any questions that anyone may have. Okay. With that, I will remind you that the Emergency Operations Center is open daily from 8 a.m. To 5 p.m. daily, 7 days a week, to answer any questions you may have about the governor's orders or other events or feeding opportunities, food distribution, and how you may help. Please call 229-302-1900. That's 302-1900, and we'll be happy to assist you in any way we can. And as we close today, I do want to remind you that the press conferences will continue. The press briefings will go back to a pretty regular schedule. We'll have press conferences on Fridays at 10 a.m. And we will be here next week at 10 a.m. To update you on COVID-19. And as I end, I'll do as I do every time we meet, and that is mask up Albany, mask up Doherty County. Thank you.